Let's roll into saline breast augmentation. I understand that last year you did 131 breast augmentations, and 60% of those were actually saline breast implants. Now, what is it with your practice and the patients that the saline breast implants take a stronger pull over maybe a gel implant?
That is a very good question. And you're right, I did do quite a number, and I think this year will be more than 131, but that's a large number of breast surgeries to be doing. Saline and gel, the real difference besides what it's made out of is the feel. I do think, and I'll hold up a silicone gel implant, this is a silicone gel implant, it's a little bit softer to the touch, a little bit more natural looking when it's in a woman's breast. But honestly, it depends on what you're starting with. If a woman has enough breast tissue, you know, saline is not a bad product. I really like it. It's just filled with water. This is filled with a real silicone gel, cohesive gel polymer. Price can be an issue for a lot of patients. We're putting in breast implants on people that might be 19, 20, 21 years old, and there is a difference in cost because it costs more to make this implant. So I think that the reason why, honestly, the reason why I did more saline than gel, I think is really more cost, because it's more cost efficient to do saline. And a lot of the younger girls have enough breast tissue. They like a faker, rounder look. They like the saline look. They live with that for 8 years, 10 years, and then they get married, have children, and then they upgrade after kids. That's the usual process that I have seen in my 14 years of practice here in Los Angeles. They start with saline and then they upgrade to gel. Not everybody, but for the most part.
You know, and that does make sense because it used to be 20, 30 years ago, we thought when we had those breast implants, we were only going to have one set for our entire life. And now we know that is not the case. That if you have a set of breast implants, you're probably going to have another one.
Correct. And when they said that back in '92 and they put the moratorium, I remember hearing, I was in medical school at the time, that plastic surgeons would tell patients that they'll last forever. So I put that in the back of my brain, and I always tell patients, these are not going to last forever. I wish I can tell you they would, but they won't. At some point, you'll call me, and we'll upgrade. We'll do another one. We'll have a new implant one day. And I think that's important to be honest with our patients. Being honest is the best policy. Really, you got to tell them what's up.